Okay. Well, this thing always gets gooped up. So I need it as big as I can get it. Bring her down a little bit.
You had something in here. We had friends. Yeah, we had friends and not so friendly friends. No?
I'm too caught up in get back now and back here.
Oh, this is interesting. Kind of slow today. Geez, I made all new slides. 7 of them were made by... Oh, there it is. Okay. So, while I'm waiting for this to come up, one of the interesting things is today's lecture is on cancer. I've experienced it twice in my life. The first one at age 29, and the second one at age 45. And the first time, I was told to go home and get my house in order, that I was going to die. And second time, I had to get home so I could treat myself with herbs and get over it. But the interesting thing about the first occurrence was I had been taught the pathology, pathophysiology of cancer. We were taught it was caused by unknown causes, probably genetics, and it got into our systems and it would start growing and eating our tissues, and we had to treat it with chemo or radiation or surgical debulking, getting rid of it. So,
Aren't they still there? The medical?
oh yeah, they haven't
They're
changed.
still there.
And as I treated my cancer, because I was sent home because there was no treatment that would work for mine that was known to the medical profession, I treated it herbally. And it was because I found Hulda Clark through miraculous things and got rid of my cancer, and it totally was eradicated for, God, I was 29, so 16 years, and then I had a recurrence because I was unable to obtain herbs at the time. The government had made it so I couldn't, and cancer recurred in this right arm, in my humerus, and it was extremely painful and deteriorating, and finally when I was able to get out and get herbs, I was able to get rid of it. But there's a lot of things that are different types of cancer, you might say. Cancer is a large group of diseases, over 200, and there's becoming more and more every day. It's kind of interesting. They had to make the ICD-10 because we're actually diagnosing different things now, because we're actually dealing with different toxins, different chemicals, different bugs that have been made in the lab, and they're characterized by uncontrolled growth and spread of abnormal cells. Now, these cells are abnormal for a couple of reasons. Cancer cells, they lose control over growth and multiplication. They just keep growing, and they don't have any kind of organ they go into or any kind of gland. They just produce cells that are abnormal. Now some glandular cancers will produce hormones, but they're abnormal hormones. That's why we have cancer markers now, is they can, in the lab, identify different markers such as CA-125, the different markers that they look at, PSA and different things. And so they don't self-destruct when they become worn out or damaged. They just continue to proliferate, and they start crowding out healthy cells and even eating the healthy cells. So kind of an interesting thing. Cancer cells, first couple of weeks, it takes about 2 to 6 weeks for them to divide. In normal tissue, in embryonic stage, they're multiplying every 2 weeks. In fact, Barbara was showing us on the computer how at 8 weeks they start out at about a ½ an inch, the baby does, and it looks like kind of a funky looking ant. And then by the end of the 8th week, it has doubled in size in infants. Well, same thing happens with tumors. They double in size about every 2 to 6 weeks. And, 1 million cancer cells is equal to about the head of a pin. 1 billion cancer cells is about the size of a small grape. So, it's kind of interesting. Signs and symptoms of cancer. How many in here have had cancer? A diagnosis of even skin cancer or something? Nobody?
Skin cancer. Skin cancer.
I know you.
Yeah.
You can tell us, Scott.
What?
You can tell us.
Oh, I
You
know.
can tell us.
I know.
Yeah.
All of us at any time in our life have cells that are abnormal in our body that would be considered cancer cells, but our immune system is able to identify them and destroy them. So all of us, they figure 8 to 10 times, and now, who knows, because we're so toxic. But some of the signs and symptoms of cancer: change in bowel habits or bladder function, sores that don't heal, unusual bleeding or discharge, lumps or thickening of breasts or other parts of the body, indigestion or difficulty swallowing, recent change in a wart or a mole, persistent cough or hoarseness. And the different types of cancer depend upon where they occur in the body and what type of cells predominate. Carcinomas are cells that cover the internal and external body surfaces. So carcinomas normally occur within the digestive system, skin, lungs, or vascular tissue. And these are kind of cool slides. So, and bladder's included, and prostate in men, and leukemia is a little different. It occurs mainly in the blood and lymph tissues. And sarcomas usually occur in muscle, bones, and supportive tissues. Now, my sister had a weird sarcoma that only occurs in post-radiation people who've been exposed to downwinders or radiation, and she had a sarcoma of the liver, which is a hepatosarcoma, which is very unusual unless you've had radiation exposure. I had my radiation exposure at the age of 28, and then a year later was when I had my malignant melanoma. So, there's different things that the medical profession feels causes cancer. Lifestyle, like smoking, ethanol, drug use, environmental radiation of all types, family history, and family history is due to families being exposed to the same things, parasites, virus, and fungus. Now, the medical profession doesn't really recognize parasites, fungus, and virus. And the reason why is in 1933, the same time they got rid of Royal Rife, they got rid of the infectious disease cause of cancers. And literally have hidden those causes for all these years. So lifestyle risks of smoking, high high in bad fats. Oh boy, this is, I love this computer. Bad fats, low in fruits and vegetables, lack of exercise, unprotected exposure to the sun, which I disagree with, obesity, and drug use. So, environmental risks, secondhand smoke, air pollution, industrial pollution, chemical exposures, radiation. I agree totally with all those. Let's talk a little bit about parasites. When I was 29, 1987, 86, I developed malignant melanoma, and I prayed, and I heard the name Hulda Clark in a dream that night that I prayed.
Wow.
And in the morning I woke up, and there was an article by Dr. Hulda Clark sitting in the middle of my desk. I read it. At the end of it was her name, phone number, address. I called the number, and I talked to her for an hour and a half about my life. And once she heard me, she said, well, move out of your house, divorce your wife, go do parasite cleansing, go do chelation therapy, do Eziac tea and cat's claw, and you will be fine. And I did everything except move out of my house and divorce my wife. So I was able to cure the cancer. Now, why did she tell me to divorce my wife and move out of my house? Environment and emotional stuff cause cancer. And my environment was, I was living in a little house in Mesa, Arizona, and very, emotional situation, and it just wasn't good for wanting to love myself. And loving yourself is very important in getting rid of cancer. Colon cancer and parasites. I'm just going to talk about colon cancer because colon cancer is huge, and it's getting worse. Despite what the medical profession is saying with their colonoscopy, more and more people are dying from colon cancer. And they're really pushing hard to do colonoscopy. What's interesting with colonoscopy, the main thing they find is polyps, and if they do find colon cancer, they recommend surgery and chemo and radiation and all the things that reduce the effectivity of our organs working and cause other cancers. It's interesting, the cure for cancers in the medical profession actually causes other cancers. So the official cause are polyps, growths in the colon or rectum. These are parasites. Hereditary predisposition, I don't believe in that. I believe it's families eat the same things, get exposed to the same parasites and fungus. Ulcerative colitis, which is going out of control with all the GMO and gluten sensitivities. Smoking, inactivity, heavy alcohol consumption, and obesity. I agree with those. People diagnosed with diabetes are 3 times the risk, and they're actually finding that maybe 3 to 10 times the risk for colon cancer if you have diabetes. So take good care of your pancreas. Basic disturbance of the gut flora. They're finding now that if your gut flora is abnormal, which means too much sugar intake, diabetes, too many chemical exposures, gluten enteropathies, GMOs, all of these change your gut flora. And they're finding the microbiome is one of the focuses they're looking at now, because when your biome's abnormal, you get cancer much more commonly. Quite interesting, William Russell, who lived between 1852 and 1940, he actually came out with, he was a pathologist of sorts, and he would find these, what they named him after him, called Russell bodies. And these Russell bodies, because his last name was Russell, he came to find that they would culture as atypical bacteria in every cancer tumor that he would analyze. He would get a culture and start growing these things, and they ended up being similar to leprosy, similar to mycoplasma, chlamydia, even Lyme's disease, which I find very interesting, because Lyme's disease is what they call pleomorphic. It can mutate into a bacteria, it can mutate into a fungus, mutate into a single-celled parasite, and even mutate into a bacterium. Now, he even had a pleomorphic cause of cancer. Multiple forms causing the different cancers. And within these cancers, he would find every time this particular type of atypical bacteria. And quite interesting. Now, Alan Cantrell, MD, wrote about the cancer microbe. And this is more recently. And he got ostracized big time by the American Cancer Association and American Cancer Society and the AMA and all of the doctors. Literally, they ostracized him and said he was nuts. But he had proof, too, that there's like a microbial cause of cancer. This shows fungus. Fungus is kind of interesting. This is a hyphae, and this is little sporidiums coming off. These can develop into a full fungus. And they found fungus present in about 90% of cancers, abnormal fungus. Candida is one of the big ones, believe it or not, and aspergillosis. Aspergillosis is a black type of fungus. And I came to find flukes, black fungus, and virus was the cause of the malignant melanoma, which I was able to get rid of by doing parasite cleansing, antifungals. I didn't do antivirals except for the Esiac tea kind of pulls virus out, and cat's claw pulls virus out. So I guess I did do all three. I did parasites, fungus, and virus, and tumors were gone within 3 months. This talks about fungus and cancer, candida and the fungal infection and how it can cause cancer. And this Milton White believed that cancer is a chronic infectious fungus disease. See, so they're all hitting around what actually does cause cancer. And he found fungal spores in every sample of cancer tissue he studied, every one of them. So he also agreed with an Italian doctor who has his patients on a teaspoon of bicarbonate of soda in a glass of water half an hour before breakfast every morning. Now, he felt the bicarbonate would kill all of the candida, thus eliminating cancer. And plus, it alkalinized the body. Now, sodium bicarbonate's cheap and pretty effective. It's good for alkalinizing. It's the best acid reducer there is on the planet. This Tullio Simonsini has a theory that all cancer is caused by candida. The candida fungus forms a vital role in the cancer's ability to survive. Candida makes toxins that impair the apoptosis process, which is the dying of the cells, and they intertwine with the tumors, protecting them with a positively charged acid glue that holds the candida and the tumors together. Kind of an interesting theory, and I think it's pretty close to the truth. Now, so we've discussed parasites being part of cancer, fungus being part of cancer. Now we're going to talk about viruses. These are different viruses, and they can come in rod forms, spherical forms, little spherical forms with all kinds of little attachments coming off. Viruses are fascinating. Transformation occurs when a virus infects and genetically alters a cell. Now you think about genetically modified food. They're using a virus and a bacterium to genetically modify cells within food. And that's how come they can patent it, because it's their own creation. Okay? The infected cells regulated by the viral genes have the ability to undergo abnormal new growth. And scientists have been able to discern some commonality among the viruses that cause tumors. The tumor viruses change cells, and basically they get in and make them so that they're immortal, that they don't have a time they die, and so they just keep on growing. Epstein-Barr virus, very common. I'll bet everybody in here has been exposed to Epstein-Barr. And we all have it in our bodies. And, well, I wish that wouldn't do that. The Epstein-Barr virus has been shown to be a link to not only Burkitt's lymphoma, but every type of blood abnormality there is. Now, one of the common viruses that's linked also with Epstein-Barr is called cytomegalovirus, which is also linked to a lot of different blood tumors and lymphomas. The hepatitis B virus has been linked to liver cancer in people with chronic infections. Usually within 10 to 20 years, they develop some sort of cancer within the liver, unless they take really good care of themselves, or they come to me and I give them antivirals and they don't ever develop these things. Hepatitis C, we'll come to that in a minute, but it also has been linked to different liver cancers and carcinomas. The human papillomavirus, not only linked to cervical cancer, but it does cause it. They have found it is definitely a cause of it. And I think it takes a combination of candida and the papillomavirus to make cervical cancer. Because if I treat the fungus and the virus, it goes away. Okay, herpes type 8 virus, all these are DNA viruses. And they're, associated with different skin cancers, different cancers of the throat, esophagus, trachea, and lungs. RNA viruses. Now, DNA is deoxyribonucleic acid. RNA is just ribonucleic acid. This is the main virus that's in our mitochondria and, genetic material that's in our mitochondria. And the viruses that are associated with RNA have been made, they call them retroviruses because they actually make them come through backwards in their replication. And the retroviruses have been developed in the lab, basically. So if somebody has a retrovirus, it doesn't occur naturally in nature. It's been made in the lab and can be propagated. The hepatitis C virus is an RNA virus. It's been linked to liver cancer, and a lot of viruses in the lab used for genetically modified foods has been linked to the epidemic of cancer, which is fascinating. These viruses are introduced to the good bacteria in our gut, making them bad bacteria in our intestines, causing leaky gut, food allergies, and cancer transformation. It's kind of interesting. They call the different parasites holoparasites and hemiparasites, and then there's both. And a lot of them occur naturally in plants, even in the plant kingdom. Orchids are considered a parasite because they need a certain type of tree to grow on in order to survive and live. Kind of fascinating. This is the end of my slides because I wanted to have a discussion rather than just talking at you. Does anybody have any questions about what we've talked about? Nobody?
I have a comment.
Go ahead.
Well,
Go ahead, and you can turn on the lights too. Go ahead.
as many of you know, I've just gotten back from the Philippines where I was working with a lot of psychic surgeons there. And even the psychic surgeon here, when I had a session, I had no idea all the stuff that I had going on in me. That when you talked about the colon cancers there, one of my sessions there, he said, "Oh, you have a tumor on your colon," and I was like shocked because I think, I'm still pretty young and vibrant and healthy. And he just reached in, his hand was buried into my stomach, about up to here, straight down into my left side, and then I could hear all this sloshing and, like when you have, you're sucking into a straw and suddenly there's a hole there. And next thing you know, he pulled up this round tumor right off the side of my colon, and I was just blown away for starters, that it was even there, and then, of course, the miracle of having it be removed so easily and effortlessly. But one of the things that, on this trip that I was on, I just couldn't believe all the nasty things that were taken out of my body, from my liver, from my bladder, my uterus, my heart, my lungs, my throat, back of my head, my spine, my knees, my legs. It was just one thing after another. And I eat really healthy. I have a bit of a sweet tooth, but I eat pretty healthy. And it just shocked me. And I see, all your classes, all that you talk about, all these things going on. What a gift you are to bring so much education. I'm so grateful for that. And to have the opportunity to have these herbs and to have you be able to just tune in and see what's going there, and then also to have people who can just reach in and take care of it rather than going the medical route where we have to be sliced up. And for me, when this happened, it was just so simple. He just went right through, he just made an agreement with my cells to go in there and take out what didn't belong there, and then the blood would kind of slosh out because there was a pulsing there, and they'd wipe up the blood and it would just close up right behind him. As soon as he pulled his hand out, it just closed up, completely pain-free. There was no pain whatsoever. There was just like a warming, kind of tingling sensation, and he would just say, pray, just pray and raise your vibrational frequency. So that was the other part that I learned too, is just the power of prayer and the power of having really healthy thoughts. Any thoughts that lift us up higher raises our vibrational frequency, which gives the body, the opening for someone who's a miracle worker to just go in and solve it. But also, if he wasn't there, even if we didn't have access to these herbs, let's say you give each one of us a reading and you say, okay, you need this, this, and this. Some of us could say, okay, we're going to get all those and we're going to do it. Great. Some of us would say, well, I know I need that, but I don't quite have the money yet, so what do I do? And first thing is raise your vibrational frequency. Do whatever it takes to get your thoughts elevated, to feel hope and joy and feel like we have some kind of mastery and internal support to be able to take care of ourselves. That if we have that high frequency, we're going to draw to us whatever we need. We all must have a really high frequency to be here, to be able to have access to this information,
Yeah.
Just the ability
Coming here alone raises your frequency.
Say that again?
Coming here alone raises your frequency. Just one
Exactly.
Yeah, just being together and talking higher-minded things, all this raises our frequency. I'm passing out the map of consciousness for a reason. The map of consciousness was developed by Dr. David Hawkins, who was an MD, PhD, who tried to disprove kinesiology, and through his experimentation and all of his testing, he found it worked. And so he found that nobody had made a very good type of chart to analyze where everything vibrates at. And what he found was in Christ consciousness, that higher vibration, and he put it on his chart from 700 to 1,000. Did you get one, Angela?
But I think we need a couple more.
Oh, okay.
Linda.
Anyway, he found sorry. He found the higher your vibration, the more healthy your body was. And Janet Garrett actually has one that you can use with a pendulum, and I've got copies of that if you guys would like one, but you can test different things in different frequencies with a pendulum. And that's pretty darn cool, so pass these out. What you do is Janet could probably describe it better than me, but you hold the pendulum and you tell it, what you want it to do, tell you the truth, and it will, and then ask a question, and it'll go back and forth where you're asking the question on this particular paper. You just set it down in front of you on a flat surface, and put your pendulum in the middle, and Ask the questions, and it'll give you answers. And you can tell where different things vibrate. But every cancer I've ever tested, have tested in fear.
Wow.
Lots and lots of fear. And guess what else tests in fear? Parasites. Fascinating, huh? So
I'm just full of them. Right?
if you're full of fear, change what you're
Well,
feeling.
it's not fear so much. I'm more in like the I've accepted and responsibility, but there's still a lot of shame, I guess.
Yeah. Now notice where acceptance.
We'll go on the next page.
Notice where acceptance is. Acceptance vibrates at 350. So if you could stay there, you'd be fine. You know? So, acceptance.
Shame, yeah, it's like the lowest. Shame is worse than guilt.
Oh yeah. Shame is right down there with the viruses.
But yeah, I think there's more grief and regret than, I guess, fear. So it's just that's what's causing depression and all those things. It's
Fungus is actually what causes depression.
Okay.
So, what would we say you probably have?
Fungus,
if you're-
parasites, every worm.
Yeah.
possible.
See, so you're vibrating in those thought forms.
Okay.
Those thought forms create an entrance for those things into our body.
Huh.
Now, when I got my virus last week, I was vibrating in self-loathing. Me, happy me, self-loathing, pretty bad. So that allowed those viruses to get in. I haven't had a virus that bad in probably 30 years. 30
Huh.
years. Usually I'm able to get them out within 10, 15 minutes. I meditate, get rid of them, it's gone. This took me a good 48 hours.
So you were going through some self-loathing? and
Yes.
the virus?
Yeah. Kind of interesting. Yeah, me. I'm human.
You are?
Yeah. So anyway, cancer, let's read about these, a form of self-destruction. Self-loathing, you want to destroy yourself, you know. So I was letting viruses, who knows what else I was letting in. So, blood leukemia, intense depression, anger, or ill will, lack of pure love for self and others. When you get it of the cervix, it's repressed anger. Female organs, repressed anger, feeling an emptiness in life, unresolved resentments, feelings of hostility being suppressed. Boy, there's a lot of different cancer things on here, isn't there? Rejecting the self, feelings of despair, feelings of loneliness, being repressed, poor relationship with parents, inability to cope with a traumatic loss. I mean, just think about some of these things. They're vibrating in not loving yourself. Mental depression. Candida. I would say 90% of depression is candida getting in the brain.
Wow.
Go ahead.
I was just listening to a channeling session from Kuan Yin that was all about depression also, and she was saying how it's like to press down or to resist. Basically, it's a resistance of what is. So that's how depression starts.
Not being happy with what is.
If you go, okay, I can see this is what's going on around me, and maybe I don't want that, maybe it doesn't feel comfortable. But if I resist what is, if I resist all those signs that are coming at me, I'm going to get depressed because I'm going to push down and create resistance. Because we have all these fears that come up as a result of, we see a situation and we think, oh, this is going to affect me in a negative way or something like that. So we start to resist it or push it down. And the depression starts and we feel like we're a victim and we don't have any say about it. But it's so much more empowering to just say, okay, all right, this is what is. All right, I'm not going to resist it, and I'm going to find the gifts, and I'm going to find the good in whatever is there. Like they say, there's poop, there's a pony. So look for the pony. You're in a pile of shit, look for the pony.
That's right. Listen to this. Not open to light or divine help. Subcutaneous death wish. Subconscious death wish. No desire to live. Skin cancer, a form of destruction due to feeling inadequate or unworthy. That totally described me back then, even though I was an OBGYN. I had a great job, making lots of money. Anyway, the bottom line is, cancer is a lack of self-love. It's a lack of love, period. And I found if I can get people to stand in front of a mirror and just say, I love you. State your name, Scott, I love you. And do it 3 times. Hold that thought for at least 20 seconds. It changes the energy. And you can change your direction of your life.
The hardest part is looking yourself in the eye.
Yeah, yeah, and actually
You know, you
mean
can look down kind of in the mirror, I love
Yeah.
you, but, you know, right out there.
It's been fascinating. I've dealt with women with stage 4 breast cancer, which is definite lack of self-love. And, you know, if I can get them to start loving themselves, their cancer will go away, no matter what I do. Now, it does help to kill the parasites, the fungus, and the virus. Don't get me wrong, because I have found that's very effective. Even if you don't continue to love yourself, that will get rid of your cancer. But sometime in the meantime, you've got to learn to love yourself, or it's going to recur. It's going to come back.
That was my major message when we went to Peru, was to love myself.
Yeah.
It was a huge message.
It's a huge message.
It
Huge.
was amazing.
God, if we could love ourselves 24/7, just think how much healthier we'd be.
I might share quickly my story. At age 36, I ended up with melanoma 6 months after I had her. And I was in a very depressed state at that time. My marriage wasn't going well. We were struggling financially. I had 5 church jobs and just could not do enough to be good enough. And then I had a reoccurrence I had surgery, and had a reoccurrence a year and a half later on the other leg. The first one was on the right leg. And I was really scared then. And they told me not to get pregnant again. I wouldn't survive with all of their patients who never got pregnant, who didn't make it. And so I needed to do something permanent with that. And then having the reoccurrence, I would have a reoccurrence about every 2 years. I'd had one within a year and a half, so that's the pattern. And I'm like, I was so depressed, I just knew I wasn't going to be around much longer. So I just happened I almost didn't go. I went to a herbal conference that was in town, and a gentleman spoke there that it was literally like light came on in my head. And he spoke about the body being the temple, the true temple, and he spoke about all the symbolism of the LDS Church, how the all-seeing eye is the president, and sometimes seeing eye is the 2 counselors, and 12 radiant nerves are the 12 apostles, and we just went through it. It was just connecting dots from my past to suddenly, because I quit my church jobs and just took a vacation, but it became permanent. And I just woke up and I fell in love with myself. I knew I could heal. I mean, he said so many profound things. It was just literally like lights came on, and I was in such a depressed state before I went there. Yeah. And it's been 27 years. I have not had a reoccurrence, and I had a baby 5 years later, and she's 21 and has her own baby.
Yeah.
I'm still kicking.
It's cool.
And
It's cool.
I did a big part of it, I believe. Not only did I change my diet, became vegetarian and all that, but was loving myself, loving life, loving and having all these divine experiences suddenly open up to me. It was truly a life-changing experience, and I am grateful for it now, because I don't think I would have woke up.
Yeah. Sometimes it takes something like this to wake us up spiritually. And, you know, when you start loving yourself, stay in love with yourself. You know, there's times in our life that we get put down, other people inject us with this goo that alters our chemistry and our self-love. And we end up getting stuff that we shouldn't have got, you know.
And then they listen to doctors too much, and they start believing the story they're telling them, and then it goes and perpetuates even worse.
Yeah.
Things come out of it.
I have a real interesting story. There's a lady in Hawaii that we started treating for leukemia, and basically I told her she had viruses and we needed to get the virus and fungus out of her body. She didn't have any parasites. And I never said to her, you have leukemia, because I didn't want her to feed into that. I just told her, you've got viruses and we'll get rid of them and you'll be fine. So anyway, she ended up going into fear and going and seeing the medical doctors. And they told her she was going to die. And so she laid in this hospital bed for a month getting chemo, radiation. They couldn't do surgery because it was a leukemia. And it was fascinating because we went the last day we were there in Hawaii and went to her hotel room in the hospital. It was a nice room, but very full of devices, and she had IVs hooked up to her, and the doctors said she'd probably be dead within a week. Despite all of the treatments that they did that I told her she didn't need, but she went and did it anyway because that's what her doctors told her. They put her into fear and they did the treatment. So anyway, Vicki and I blessed her, and we sent really healing energy to her. We had a prayer with them, and did some blessings and toning and different methods that we do. And anyway, we left and came home, and I didn't hear anything for a couple of weeks. And I get a phone call, and they're like, "Oh, did you know Mom was home?" And I'm like, "No, I didn't know she'd left the hospital." And she said she got sick and tired of laying there with all the IVs in. Told them to unplug her. She wanted to go home. So anyway, she went home and didn't hear her again for another month. And got a call probably 2-3 weeks ago asking, "Hey, maybe the stuff you gave me actually helped because I feel a lot better. And I want to take some more." So we hopefully send her some more. I don't know, because I took off to Fairfield. But it was fascinating because she's still alive. I got a text from her daughter yesterday. She's doing good. And, it's interesting.
So she followed your protocol as well?
Yeah, yeah. But I think that she decided she was just going to go home and live her life and love herself, because leukemia is a lack of self-love. All of it is. And so if we can teach you anything today, it's to love yourself. The loving yourself takes, when you love yourself, you take better care of your body. And you change habits. People reach rock bottom, and when they have cancer, it's rock bottom. Let me tell you, you either die or you wake up from it and start taking better care of yourself. I was not taking good care of myself. I was staying up all night, delivering babies, drinking Coca-Cola, I thought I was, doing the dream life, but, because I enjoyed what I was doing, but I didn't love myself enough to take care of myself. And I was stressed out. The average OB dies 10 years earlier than the average doctor, and the average doctor dies 10 years earlier than the rest of the human beings. So,
Wow.
I was setting myself up to die about the age of 55, which I've passed by 2 years now, thank goodness. And I'm probably going to live longer than the average person because I've actually learned to take better care of myself. And so, you look at your life and you go, wow, there's a lot of different things I could do to enhance my life. Now, getting out into nature, I think getting out and grounding yourself and exercising are so important to keep depression away, number one. Because you get out in the sun, you get more vitamin D. Vitamin D has actually been shown, higher levels help you with depression and help you get out of depression. So,
I'm always looking for information on sound, and a recent statistic shows that 2 hours of being out in natural sounds, which is hard to do unless you go out away from
the city.
But I tried it one day, and it was like, I thought I could go up to the spa and just be there in the parking lot and listen to birds, but here come these guys in motorcycles, and it was just the guys with the weed blowers and, anyway. But they say that 2 hours of being in nature with natural sound reduce the stress hormones by 800% and activate the DNA for healing.
Isn't that cool?
Isn't that wonderful?
Yeah, yeah. You know, it's
No wonder we
interesting.
love to be out in nature.
Yeah, our house is in the middle of a bunch of people who spray the insects and do all kinds of stuff, but ours is like a little oasis in that the birds all come to our yard because we don't spray. And we've got bugs, natural bugs on the ground, so they have good stuff to eat. And it was so fascinating because we have a dove nest above our fireplace flue that comes out, and a hummingbird nest. And so we've got peace and harmony and sweetness of life just right there propagating right in our yard. And it's amazing because I go out there and sit in the morning and there's all these birds and they're singing and all kinds of stuff, and I go walking in the neighborhood and there's nothing. They know where they're not going to be killed or harmed. And so, you know, it's a nice little oasis to be able to go outside and listen to the birds, and it's very calming. And I enjoy doing that a lot because of the birds, the natural sounds.
And I work at Home Depot, but when I'm in the garden center and I can hear the birds and
Yeah.
I'm watering the plants and I'm around all the plants, it just makes my whole, my day at work is like, it's awesome. There's beautiful flowers out there and colors and green, and I'm just like, I just love it out there.
Yeah, it's anti-cancer. It's anti-cancer. I agree with the harmonics of the sounds, the light, the water flowing is very good anti-cancer. Flowing water. Flowers. Having flowers around you, especially live flowers, not that have been picked, but planted flowers is very good. Well, even the picked ones is good for you, but they will go away fast. But if you can have good plants around you, very powerful.
How do you feel about Go ahead.
What about living near electric lines?
Okay, electric lines falls into environmental pollution. They actually, when I was living in Mesa, Arizona, of all places, they did some studies on electrical lines, and they actually banned people from building homes within 1,000 feet of these electrical lines because they found it increased the rate of cancers, psychosis, all kinds of things. And it's electromagnetic frequencies, and especially the AC, the alternating current. It switches on, switches off, switches on, switches off, you know, at a rate of 110 volts and whatever hertz it is, but it's very bad for your body. It's a frequency that kind of disrupts the tissues. And they found cancers are much higher, especially in children. So they literally wouldn't allow people to build their homes within 1,000 feet. You know, around here we have homes built right next to them. And it's that. Yeah, and the schools are exposed to them. You think about hyperactivity in kids, you know, that alternating frequency probably just disrupts their brains.
Screen or something. I've seen these little things that you can put on your cell phone. I don't know if they work or not, that interfere with the
They do work.
They work.
They do work.
So
Yeah.
is there something that you can do like that if you live somewhat close to it?
Absolutely,
You know,
absolutely.
or-
You can use crystals. You can use electromagnetic dissipators. You know, putting stones around your home, rocks, is very powerful, and blessing them to protect your surroundings.
Aren't there medallions that you can get?
Medallions work
That you
good.
wear.
With $4?
There's this energy called scalar energy, which I used to kind of freak out over because it was dark energy, they call it. But I found even good can come out of darkness, so you bless it. And I actually have a scalar medallion on my phone that dissipates and sucks in all negative energies into like a black hole vortex. And I've learned to like scalar energy. It's actually very powerful and good to remove negative energies. So there's things you can do to dissipate it. We put 500 crystals in the house we're building, and blessed each one of them as we placed them and put them throughout the house. And let me tell you, the energy feels so good. I just love going over there just to be in the energy of this new house. And it's not just because it's a new house, it's because we've done things to alter the energy and make it better. So you can do that anywhere you are. So it's fascinating stuff. Any other questions?
What about the power of the I am statement? I am strong. I am
Oh,
healthy.
man.
I love me. I am perfect. I am.
Yes.
I am. I am.
Yeah, it's fascinating. One of the most powerful loving statements you can say to yourself is, I am in love with Scott. That's one of the most powerful statements I can make. Not just, I am in love with Vicki, I am in love with Scott. And the I am statements, you know, I am that I am, is so powerful. I would use them all the time. All the
Some
time.
people say, oh, I'm just sick. Well, guess what? They just
Yeah.
stated that they are, so they're going to be there.
Yeah, yeah.
It's that powerful.
Yeah, Esther Hicks gave an entire lecture on the I am statements and holding energies, and found that if you hold a statement for 20 seconds, and Catherine Beck used to say this, you know, cancel those negative statements within 20 seconds and replace it with a good statement, and you replace and change the energy. And so I love, you know, keeping these little booklets around and the map of consciousness around, just so I can look at where my thoughts are and keep them in a higher vibration. And the highest vibration is love, gratitude, you know, compassion, helping others. You know, I was told way back 30 years ago, as you heal others, you're actually healing yourself. And so if you help others to heal, you're healing your own body, because we're also interconnected as humanity. You know, currently the United States vibrates in fear. Where does fear vibrate? Parasites. So it's no wonder, you know, the rate of parasitism in the United States is estimated at 95% right now. We've all got parasites.
Wow.
Because we're all vibrating in that collective of fear. And so if we raise our vibrations up, we actually help clear people and heal them. We'll eventually be raising our own vibrations. And if we can get 144,000 of us vibrating in unconditional love, we'll ascend, basically. So, very important.
It's a very small amount
No, it's not that many.
in the whole world.
But there's not that many vibrating that high at any one moment, or we'd have done it already. So it's kind of interesting. Go ahead.
When you're around a lot of animals, assuming you guys get a dog, so you then consider oneself with parasites, then you have that possibility of coming up again.
Yes. Now, with different animals, they found that animals who are abused and neglected and those kind of things, they get cancer, they get tumors, they get all kinds of problems. But they found if you love your animals and your animals are in a loving environment, they do very well. And so, you know, just taking good care of animals actually raises your own vibration and their vibration. So I believe animals are a part of the picture. If we take good care of our animals,
For the
we're
animals
raising
that they
vibration.
produce food from, chickens and beef and things, if they're treated poorly, you might eat them, but you won't get much good out of them.
Yeah,
There's
yeah.
no good energy.
Yeah, you'll get that negative energy and that killing energy. There's a lot of factors with animals, and I'm not totally vegetarian. I need meat. About every 3 weeks, I start craving meat if I haven't eaten it, and I get weak. And so I'll test you know, use my testing, and I'll find a good piece of meat and eat it and bless it. And,
I think the animals agreed to do that for humanity.
yeah.
But, you know, some of them are just raised in boxes all their life, or no room where they can even turn around, just keep laying eggs or having babies or whatever, and
Yeah.
they aren't loved.
It's not a good life, and their vibration is lowered because they're miserable.
Something I'm finding fascinating, and I've noticed it, read about it now a couple times in the last month, that we've never thought of before. But talking about the animals, and there's all this idea of the fear-based global warming and environmental issues. But all of a sudden now, these articles are coming out showing where they've done the testing and the statistics, and it's the monoculture again of the collection of these poorly fed animals and not allowing them to graze in the natural state that is causing this pollution, because the monoculture idea has destroyed the soil, the fact which is destroying and changing the temperatures. But I've read 2-3 articles recently that this new theory is we've got to get back to growing just exactly what she said, growing the animals out in their natural state to allow them to be better, which alters the bioculture, or whatever the term is, of the land.
And of their biomes.
Of the human, and also of the atmosphere. So I
Yeah.
think that's fascinating.
Yeah, it is fascinating. They found that bad fats in animals can actually be made into good fats if they're grass-fed and out.
Well, they are.
They're good.
The grass-fed cow is the 3, 6, and 9 omegas are perfectly balanced.
Yeah, yeah. Donna?
That's why we have chicken.
That's right.
That's right.
That's why every time we test, we can't get rid of them, because we're actually raising them in a better environment.
Yeah.
So, and they're better for us.
And they're happy,
And
they
they're
love
eggs.
Donna.
And they love Donna, and boy, they'll hop in her car every day. They're just your best friends. Go ahead.
So when you have someone around you that has cancer, I think I've got to watch myself on fear that I don't want to get something from them. You know, there's that fear.
Well, there is that infectious disease part, but if your vibration is high, you won't get those things from them. If you're in a compassionate, loving mode when you're taking care of them, you're not going to get anything from them. I was a doctor and treated people with horrible cancers, horrible things, and I would go into the room, I'd be happy, loving, good bedside manner. I'd raise their vibration while I was in there, and I didn't even know what I was doing back then, but you know, it was just my personality. And my cancer didn't come from anybody except my own self, not loving myself. And so if you're a caretaker, just love, just go in with compassion, and you won't be harmed by their energy. The best protection we have is compassion and love.
Well, the truth is we have cancer cells floating around in us all the time. It's just whether they get activated or not.
Yeah.
And they get activated when we go into fear, which that's
Right.
the thing. When somebody gets a diagnosis of cancer, they immediately plummet into fear. Oh crap, what am I going to do? And all of that. And that's what makes it much more realized and starts spreading and growing. But you know, I remember, like, when I went to the whole breast cancer thing, on my trip I was with somebody who had gone and had all kinds of surgeries on her breast and just had gone through all kinds of things, and then later went through the natural route for the things that came after that. And I remember her saying, well, something about, you know, when was it diagnosed or something like that. I said, are you crazy? I'm not stupid enough to go get a diagnosis. You know? I just go to Scott, yeah, you got something going on, let's get on it, you know. The diagnosis is the thing that activates it and makes it real and starts spreading and growing.
Oh, yeah.
You know, a lot of people have the philosophy, well, you need to get a diagnosis because you need to know what you're dealing with. But I just don't buy that at all, because
You're dealing with fear,
Right.
and the
That
diagnosis
puts
creates
fear in you.
more fear.
And if you don't know for sure what it is, but you know, okay, there's some fungus or virus or something like that, and a parasite, I need parasite cleanser, or you just start doing the things that you need to do anyway, whether it's for sure going on or not going on, or early stages or whatever,
Yeah.
you can solve it before it gets.
Yeah.
I had a thought really quick.
Oh, go ahead.
Well, in microbiology, I learned that we all get cancer throughout life, but our body is strong enough to fight it off. And then this is until you get to that point where you can't, that's what they said.
Yes.
But, okay, so then I'm thinking, what if you go to the doctor for a diagnosis, and they just happen to catch it when you have it, when it would have just gone away? But when they start applying their methods of treatment, your body becomes weak,
Yes.
and you become more fearful, and all those things, and there you have it.
Yeah. Yeah.
You know, I thought this a long time ago. I had.
Yeah, I'll never forget when New York City had all the doctors go on strike and the death rate went down. You know, it just, I'll always be reminded of that. So, next week we're going to talk more about how to treat cancer once you have that diagnosis. Or you know you have it, but you haven't been diagnosed because you're smart and don't go to your doctor. But, yeah, we'll talk about that next week.